in partnership with Mary Kind School for Learners with Hearing Impairments based in Observatory. Today, we commemorate the International Day of Persons with Disabilities. In doing so, we aim to foster a society in which all sexual and reproductive health and rights matters are inclusive. This year's theme, Building Back Better towards a disability inclusive, accessible, and sustainable post-COVID-19 world, seeks to illuminate the experiences of young persons with disabilities during the pandemic. Realizing the sexual and reproductive health and rights of young persons with disabilities is crucial to ensuring that no one is left behind. The COVID-19 pandemic has increased isolation, vulnerability, and has diminished services globally. The day-to-day functioning has been disrupted, reworking the ways we have had to move about the world. Young persons with disabilities experience such changes to a greater extent. They continue to experience inadequate access to healthcare and sexual and reproductive health information. Youth overall are affected significantly by the closure of social spaces, including schools, health clinics, and community centers. The pandemic has stretched healthcare systems as providers, essential medicines, and supplies are diverted in response to the pandemic. And often, sexual and reproductive health and rights are seen as non-essential. We need to change this. Today, we are joined by Professor Finn Reagan of the Human Sciences Research Council, Patricia DeLaura of Partners in Sexual Health, Maria Bacarodas of UNFPA, Clubisile Masinga of the Pink Roses Foundation, and Dr. Jill Hancock of the South African Medical Research Council. Unfortunately, Dr. Hancock will not be able to join us today. However, she has sent a video in her absence. I now give over to our first speaker, Clubisile Masinga. Thank you so much for joining us today, Clubisile. You may take the floor.
Thank you for having me. Okay, starting up. Okay. Hi, everyone. My name is Clubisile Masinga. I am a 24-year-old queer woman from here in Durban, South Africa. As you can see, I also happen to have albinism. I'm the founder of the Pink Roses Foundation, which is an organization that deals with sexual reproductive health rights information for young people with disabilities. So most people look at me and hear the fact that I say that I usually present myself as a queer woman or as a gay woman, however you like to say it, and instantly like a lot of eyebrows are raised because especially here in KZN where most of our society is very traditional, people don't expect a young woman with albinism to be queer. And that for me is why we need comprehensive and inclusive sexuality education and sexual reproductive health services that are specific to young people with disabilities. I have a lot of friends and work with a lot of people with disabilities who, for some reason, society has decided or expects them to be asexual. This could be from guardians limiting their access to sexual reproductive health services, health providers not having the proper tools or approach on how to help young people with disabilities seeking sexual reproductive health services, thus demoralizing them to even seek the services in the future, to even there not being enough, if any, spaces that offer comprehensive sexual education services that are specified for young people with disabilities. The cases are even worse for young women with disabilities in rural areas who, unlike me, weren't lucky enough to be exposed to civil society organizations that teach about sexual health and all of that. And this is why we have to make sure that we empower these girls with sexual reproductive health knowledge to make them sexually aware and actually in helping them to make better sexual choices, thus limiting the risk of unintended pregnancies, risky sexual behaviors, STI and HIV infections, and avoiding getting or not getting services related to gender-based violence. A lot is already happening on the ground in some areas to improve access to sexual and reproductive health services for young people with disabilities. But also, a lot more still needs to happen, from having disability-friendly youth spaces in some of our clinics with at least one sign language interpreter to increasing support services for organizations trying to ensure that no one is left behind in our plight to ensure sexual reproductive services for all. It is also our responsibility as community organizations to ensure that we provide our young people with comprehensive and accurate information. So today I'm glad that we joined with by all of you to discuss sexual reproductive health services for young people with disabilities. And it is my hope that this is the first step in the right direction to making sure that no one is left behind when providing better sexual health. Thank you.
Thank you very much, Kubisile, for providing us a great overview into the lives and experiences that young people with disabilities experience. Next up, we have Dr. Finn Reagan. Thank you for joining us today, Dr. Finn. You may please take the floor.
Great, thanks so much, Sandeka, and thank you to Kubisile for a fantastic start. It's a real pleasure and an honor to be here today. And thank you very much for the invitation. Looking forward to being part of the conversation and to learning from everybody in the space today. I'm Finn Reagan from the Human Sciences Research Council, the HSRC. I'm a director there, and I also hold a professorship in educational psychology at the University of the Western Cape. And myself and the team, we lead projects across Eastern and Southern Africa, focused mainly in education, on the school system, and on making sure that schooling systems across Eastern and Southern Africa are safer and more inclusive for all young people. Access to SRHR, to sexual and reproductive health rights and supports, is an intersectional conversation. It's intersectional necessarily because we need to be thinking about out of school young people in terms of how best they access sexual and reproductive health rights and supports and services. We need to be looking at issues of gender, young women and girls, at lesbian, gay, bisexual, transgender, intersex and queer young people, and their needs and the challenges and the opportunities that are there in the school system for linking young people to the supports that they need. We need to be engaging with the challenges and the needs of young people who are homeless, of young people who are living in poverty, and of young people who are leading the households in which they live. And today is an important day. The International Day of Persons with Disabilities is a call to us all to be thinking more deeply, understanding more deeply the issues that arise in terms of access, particularly the access of young people with disabilities to SRHR supports and services, the rights that are there for young people to access these supports and services, as well as the political, social, economic, and cultural opportunities that are there for young people with disabilities to rise and to lead in terms of ensuring that our societies and our school systems are more inclusive. But the challenges are pretty immense. We know that around 1 billion people with disabilities across the planet face barriers to inclusion, reduced access to transportation, reduced access to employment, to education, and to social and political participation. But at the same time, we know that when we create systems and societies that are more inclusive of all people, including young people with disabilities, that we do create more stable democracies, we have more active, engaged citizenship, and ultimately we have more equal and inclusive societies for all people. So the conversation is about agency. It's about the agency of young people with disabilities that Kubisile was talking to. It's about leadership, about young people with disabilities stepping up and leading us towards societies that are more aware, that are more inclusive and more egalitarian. In effect, young people with disabilities becoming advocates, as they already are, for change in the societies and the education systems that we currently have. So we're thrilled as the Human Sciences Research Council to be here today with the South African Medical Research Council, with our colleagues at UNFPA, with Pink Roses, with Floricile and her team, and of course with partners in sexual health. Many thanks to Tandeka, Hamlet, Patsy, and the team for today. But are we really leaving no one behind? It seems that 2020 has taught us that we can do better. COVID has showed us that too many people have fallen further behind because of lockdowns and because of responses to the global pandemic. And why am I flagging this? Because we feel a sense of duty and a sense of responsibility at the Human Sciences Research Council to ensure fairer and more equitable societies. That's our mandate, to develop the evidence base, to develop the research, to move us all towards more inclusive societies. And so at the HSRC, currently leading a project called Schools Out. And the Schools Out project is a large project with many civil society partners across Eastern and Southern Africa. And the focus of the Schools Out project across Eastern and Southern Africa is on developing the evidence base and knowing more about what works best to make sure that young people in schools are linked to the SRH supports and services and CSE that they need. And as part of this, we are currently rolling out a campaign and have been rolling out a campaign in the region with events similar to this one, where people engage in conversation and advocate for change. Why we think the Schools Out project is important is because it's a partnership. It's a partnership between researchers and civil society organizations. And why is that important? Well, because we think that in developing the evidence base, in knowing more, in having more research, that we can ensure that advocacy is stronger, that it's evidence-based and informed by what we know of the realities of young people with disabilities in schools and their needs in terms of accessing CSE and SRHR supports and services. It also assists this evidence base developed by researchers and civil society organizations to ensure that policy, whether it's in education or whether it's in health, is more attuned to the lived realities of young people with disabilities, and that policy is implemented and rolled out nationally and across Eastern and Southern Africa. And ultimately, Schools Out and our work and our partnerships with working alongside our colleagues, with yourselves and with civil society here and across the region is to ensure that young people with disabilities are no longer last in line when it comes to accessing SRHR supports and services. Thank you.
Thank you very much, Dr. Finn, for such important information. I think one thing as we continue to commemorate the International Day of Persons with Disabilities, it's important for us to remember, and as Dr. Finn said, are we really ensuring that no one is left behind? Thank you, Dr. Finn. Next up, we have Mrs. Patricia Delora from Partners in Sexual Health. Thank you for joining us today, Patsy. You may please take the floor.
Good morning, everybody. My name is Patsy Delora. I'm the founder and CEO of Partners in Sexual Health. I want to say thank you very much for the people that joined us today, commemorate the Day of International Day of People with Disabilities. And within South Africa, indeed, we're also celebrating and make sure that we actually increase so that people understand the rights of people with disabilities. So what I need to talk about, and thank you, Professor Finn, to actually start the process and the talking about what we're doing today. And in terms of our project that we've launched in partnership with the Human Science Research Council, UNFPA, the Medical Research Council. So yeah, we're very excited about our project, which is called Leaving No One Behind. I just have to take you a little bit back for you to understand how this whole project actually came about. So we are very privileged and thankful for the Human Science Research Council that provide us funding for this project. And interesting enough, so when the call came out, as Professor Finn was saying, there's quite a lot of different organizations, part and puzzle of the Schools Out campaign, which is involving quite a lot of different organizations. So PSH actually decided that it is high time that we put action towards. If we talk about leaving young people, not leaving people behind, people with disabilities, we need to do something. So what we did as partners in sexual health, we've scanned to make sure that what is happening, what projects, what interventions are being happening with young people with disabilities in terms of SRHR. We've invited a variety of different role players within the field of young people with disabilities. We set a meeting that was about a year ago in Johannesburg, just to get a sense of who is doing what. We also believe as partners in sexual health that we do not believe in reinventing wheels, rather look at what people have done so far within this field, and then we decided to complement rather than starting something from the bottom. And that is how we got about partnering with UNFPA and the Medical Research Council, because they've been doing significantly work over the past 10 years to look at sexual reproductive health and rights, young people with disabilities within the school structure. So this fit in nicely with Schools Out campaign and program of the Human Science Research Council, because our intervention should be school-based, although we know that the other school young people also desperately need these type of interventions. But I think it's important that we realize that at least we're starting somewhere. So the leading projects that we can based on evidence, and I think that's the most important thing. It's based on evidence. We will be able, after our intervention, to share these with other people across Africa specifically, so that we can start doing interventions within the school setting in terms of competence promoting accessing to SRHR services. So the Leaving No One Behind project, as I said, have been started 10 years ago. We came along and we gave it momentum, as we are a civil society organization. So that's why we're partnering with the research fraternity to ensure that what the research they have done, we've actually now put it into action. So we are privileged that the Department of Education nationally are in support of our intervention. So what we do within, and in fact, let me take also just to say that unfortunately COVID messed up this whole project. All know that schools, very difficult to get into schools currently. We had to revise our approach. The original methodology that we were supposed to take was to include young people with disabilities and the teachers. But due to COVID and the time span that we actually have left to implement this project, we were obliged to change a little bit. And therefore, our project currently are only involving teachers. So we are going to train teachers in terms of our evidence-based curriculum on CSE and access to SRHR services. These teachers then, on their part, will be able to actually educate our young people with disabilities in terms of comprehensive sexual education, and also, in a sense, to empower these young people and to have the knowledge and to know what is their rights in terms of sexual reproductive health. I think that is very critical for us. As I say, it's imperative for us to ensure that young people with disabilities are genuinely not being left behind. In my lifetime, PSH is about 11 years old now. We've been dealing with young people across key populations. We deal with LGBTI people. We've met 3 years ago with the young people for the blind. One of the key things they told me a few years ago is that PSH was the only organization that approached them to ask, what can we do to improve for them, to provide them with comprehensive sexual education and also teach them and empower them on their rights. So this is one of the journeys that PSH have been very keen to embark on. So we are very privileged to ensure that whatever we do in terms of young people, not just in South Africa, but in the SADC region, where we're currently also working, for these young people to actually have these type of services and information and knowledge, so that they can be empowered at the end of the day. So the Leaving No One Behind project only are taking slowly but surely taking place currently because of the COVID, as I say. Our manuals have been already developed. We are busy outlining the designing. We are very excited. Today was supposed to be a live launch of our Leaving No One Behind with the BTS approach that we're actually embarking on. But due to COVID, we've moved on to Zoom, but also just for people to understand that we acknowledge and we are very passionate to make sure that our young people will be able to gain access to information and access to services, and basically saying people with young people with disabilities will never be left behind again. And I think we will make sure that whatever we come up with this whole project based on evidence will be shared. People will actually utilize this so that we can help our young people. So from my side, thank you.
Thank you very much, Patsy, for that great introduction and overview of Leaving No One Behind. And I think it's very important today, as we continue to commemorate this International Day of Persons with Disabilities, that we keep this continuously at the forefront of our minds. Are we doing everything that we can to ensure that we're living in an accessible, sustainable, and inclusive world? Thank you, Patsy. Next up, we have Dr. Johannes Hancock's presentation. Numfundo, her assistant, will be taking the floor and reading her bio. Welcome, Numfundo.
Hi, everyone. Okay.
We can hear you.
Okay. Unfortunately, Prof. Jill couldn't be with us today, but has shared her presentation. So Dr. Jill Hancock is a senior specialist scientist at the South African Medical Research Council, Gender and Health Research Unit. Within the last 10 years, her research has made significant contributions to the understanding of HIV risk factors for people with disabilities, the gaps of disability inclusion in health-related policies and programs, and the design of interventions that increase the participation of people with disabilities, targeting healthcare workers, educators, and policymakers in the Southern Africa, and focusing mainly on the marginalized and often hidden group of people. She applies community participatory approach in her work. So now I will just share her presentation.
Welcome. My name is Johannes Hancock, and I'm a senior specialist scientist at the South African Medical Research Council. I am presenting you today. I would like to start with a quote from Anne Finger. Sexuality is often the source of our deepest oppression. It is also often the source of our deepest pain. It is easier for us to talk about and formulate strategies for changing discrimination in employment, education, and housing than to talk about our exclusion from sexuality and reproduction. Anne Finger is a person with disabilities, but also an activist and an educator. And as you can see, sexuality of persons with disabilities is still a silent issue, and we need to break this silence. So what do we know about people with disabilities in Africa? We know that they lack access to environments and services and often experience communication barriers, and that includes to sexual and reproductive health services. We know that members of communities may hold negative beliefs and misconceptions about disabilities and may even practice harmful practices. On a household level, we know that households with members with disabilities experience higher household expenses and have lower income. Caregivers may lack knowledge and skills on how to talk about sexuality and relationships. They may be overprotected or negligent, but they are often overburdened. Caregivers may also depend on perpetrators and therefore not report or prevent violence. On an individual level, we know that children with disabilities are more likely to be out of school. People with disabilities are also less likely to be employed and may have higher levels of dependencies.
How are you?
They experience barriers to access services, including wash services, menstruation information, and commodities. Women with disabilities are more likely to experience violence, and young people have lower knowledge about sexuality and reproductive health and access to information. So let's look a little bit more detail at violence and women with disabilities. We do know that people with disabilities are more likely to experience violence. That has been published in 2 systematic reviews in the Lancet. We know that women with disabilities are more affected by violence than men with disabilities. The best program showing this comes from What Works, a project that has done several studies across low and middle income countries and has shown that women with disabilities are 2 times more likely to experience intimate partner violence when compared to women without disabilities. And this risk increases with severity of disability. When we look at the risk of HIV, again, several studies in Africa have shown that there's a higher HIV prevalence among people with disabilities. One of the best studies comes from the Boudekap and colleagues, and they have shown the increased HIV risk and the increased risk of sexual violence among women with disabilities. Here I've chosen a study from Burundi, recently published in the Lancet. That study is interesting because it compares people with and without disabilities, men with disabilities to women, and those who have acquired disability before they were 10 years old and those afterwards. The latter is relevant because HIV can also cause disabilities. The study can show that it is women with disabilities who are at higher risk of HIV infection and at higher risk of sexual violence, and that risk increases with social isolation. But that risk is also higher for those who acquire disability later in life. So why are people with disabilities more vulnerable to negative sexual reproductive health and rights outcomes? The reasons are diverse, and they reach from a lack of inclusive sexual reproductive health policies to endemic levels of physical, emotional, and sexual violence, cultural misconception about sexuality and disability, an increased risk of poverty amongst family with the members that are disabled, a lack of access to services, in particular reproductive health and rights services and commodities, and here interesting for us, a lack of access to comprehensive sexuality education. So what do we know about people with disabilities and access to comprehensive sexuality education? Again, it is a silent issue, and we have very few studies focusing on this. I've chosen here a study from the United States because it's one of the few studies using statistics. And this study shows us that individuals using special education services have a very low rate of accessing sexuality education. This is even lower for people with intellectual disabilities. In Africa, we have more qualitative studies, and again, they indicate a lack of access to sexuality education. But they also show us that is driven by misconception about sexuality of people with disabilities, cultural taboos and myths, and lack of skills and tools for educators who are rather practicing a protective approach and talk little about sexuality in their lessons. As a result, most CSE topics are not covered and spoken about, and we need to break the silence. So breaking the silence is an evidence-based approach to comprehensive sexuality education for young people with disabilities. What does the approach do? It's not only an evidence-based approach, but it draws also on social learning theory and utilizes group-based learning through participatory methods and the whole school approach that can include community, parents, and peer support. We developed this approach based on available literature, but also on a needs assessment we conducted with educators in KwaZulu-Natal, South Africa. The approach then aims to provide educators with skills, approaches, and tools to deliver comprehensive sexuality education in the classroom, but also to stimulate normative change to overcome personal and community-driven social and cultural barriers that are relevant in the African context. Hence, we try to provide the how to provide sexuality education via the curriculum of a country of South Africa, and as well as the UN technical guidance tell us what we need to do. So what are the components of breaking the silence? Again, it tries to address the numerous issues related to sexual reproductive health. We have developed a conceptual framework in the theory of change. We also have developed teaching tools and a learning resource package for educators in and out of school. We have developed an assessment for sexual reproductive health services, and we have developed a research knowledge generation hub and the policy analysis tool. Here, I'm telling you more about the Breaking the Silence Teaching and Learning Resource Package. What does that entail? It has 3 components. First of all, a comprehensive resource guide with teaching tools that provides the educators with the understanding why and how to provide sexuality education, as well as the tools to do it in the classroom or outside the classroom. In order to make it easy, we developed a minimum package on scripted lesson plans that teachers can use. Those 2 are for the teachers in the classroom. In addition, we developed an educator workshop and trained the trainer guide to enable educators to use the comprehensive guide and the minimum package. What do these resources cover? First of all, they align to the UN technical guidelines on CSE, which are having 8 concepts. 6 of these concepts are covered in the 6 modules of BTS and related to relationships, violence, skills for health and well-being, knowledge about the human body and development, sexuality and sexual behavior, as well as sexual reproductive health. Across these 6 modules, the other 2 UN concepts are integrated, those focusing on rights and gender. We have implemented this approach with teachers, and we have tested what it is like for them to implement the approach. First of all, we can say educators can learn how to provide CSE. A misconception that teachers cannot learn how to implement it has been addressed. However, we also found that educators need space to discuss issues that are related to themselves as well as in the classroom, and to understand how to implement the right-based approach. Teachers definitely need tools to provide accessible CSE and to adapt their lesson to the needs of their learners. A whole school needs to be involved, so teachers are not isolated when they teach about sexuality, and they can actually address normative beliefs. Schools need to also have internal CSE guidelines to identify how they want to practice CSE and how they prefer critical cases. They need reporting structures on sexual violence because it is likely to increase uncovering of sexual violence when you teach learners about their rights. And parents need to be involved. Hence, they need to be approached appropriately. That is possible with BTS. I have selected here a number of publications. You can find more of these publications on our website. This, I would like to thank all of you for listening to BTS and encourage you to visit our website. Thank you very much.
Thank you very much, Mfundo, for displaying Jill's presentation. To everyone in the audience, please note that all resources will be made accessible on our social media pages after the event, including a live recording of this dialogue. Up next, I would love to welcome Ms. Maria Bakarodis to the stage. Thank you for joining us today, Maria. You may please take the floor.
Thank you to everyone on this call. We're happy to commemorate this International Day for Persons with Disabilities with a focus on young persons with disabilities. I'm from UNFPA, the regional office based for East and Southern Africa, which covers the 23 countries of East and Southern Africa, and we're based in Johannesburg. And we send greetings on behalf of the whole UNFPA family. We have been committed to persons with disabilities for quite some time. If you look at our landmark ICPD program of action, where we celebrated the 26th anniversary, you'll find quite a number of mentions of disability in that landmark document that sets the program of action for sexual reproductive health and rights. And we continue our commitment in that regard and leaving no one behind. In fact, we are stepping up our efforts to prioritize the needs and rights of persons with disabilities in everything we do, including our COVID-19 response efforts. We're building better data, stronger guidelines to make disability inclusion more systematic and human rights based. You know that you may know that we recently launched an international technical and programmatic guidance for out-of-school CSC, which complements the other international guidance on CSC, which that one, the first one, is more about the content of CSC and age appropriateness and learning outcomes and that sort of thing. But this new one that was just launched a couple of weeks ago recognizes that disabled young people, as well as other left behind groups of young people, may need to be engaged in out of school programming. So that's a new resource, and we really urge you all to have a look at that. We also at UNFPA have global and regional strategic guidance documents to strengthen health and education systems. When you work with young people more generally, you'll often hear people talking about youth-friendly services. Well, we're actually moving beyond youth-friendly services, and we're looking at youth and disability responsive health and education systems. And the idea there is to really make this sustainable, make it so institutionalized that, you know, all of our countries should have had inclusive sexual and reproductive health policies and services for persons with disabilities. But we know we continue to do more. We need to build the quality. We need to improve accessibility. And I think that's why we're all here together. So I'm not going to go on with speeches and things. One thing I get to do, which is very exciting, and my colleague Hamlet will help cue up a video, is show you actually what type of sexuality education tools we have. Right now, we have an Amaze video project, which are short animations that are primarily focused towards the 10 to 14-year-old age group, so very young adolescents. And we have these videos. What we found that these videos came in handy during the lockdowns and school closures. And so we realized going forward that we need to continue to have a combination of modalities, approaches, tools, both digital, radio, traditional face-to-face, in our arsenal in how we better serve young people with disabilities. So without further ado, I want to show this video. Hamlet, may you please play the video? And I want everyone to please react to this video in the chat box. After this very short video is played, we will open this up for discussion so that we all have an opportunity to share and talk about the video and what we're all trying to do in terms of increasing access to SRHR information and services to young people with disabilities. Over to you, Hamlet.
Great, so I'll see you at 7.
Hey Alex, was that about the Youth Debate Club? I have a new topic we can discuss. Shako or Black Panther, it's gonna be incredible.
Oh, sorry, I was gonna tell you. I can't make it tonight. Going to a movie with Jabu Sonke.
Jabu Sonke? Student body president, first head drummer in stage band, 5-time debate winner in our school team. She's so cool. I didn't even know you were into that.
What do you mean debating?
No, like, you know, dating. I mean, I hope it's okay to ask, but can your parts, like, do stuff?
Actually, my parts work just fine. Just because I'm in a wheelchair doesn't mean I don't have crushes or feel attracted to people. In fact, no matter what our bodies can or can't do physically, people with disabilities have the same sexual and romantic feelings as anyone else.
And, like anyone else, people with disabilities have various sexual orientations and gender identities too. From heterosexual to gay, cisgender to trans, across a full spectrum of sexuality. But are relationships more difficult for people with disabilities?
Well, regardless of my physical ability, I want the same things from a healthy relationship as everyone: respect, communication, consent, and fun. And like everyone, I sometimes have questions about relationships. Like, how do I know if someone's interested in me? How do I ask someone out? Or how do I turn someone down if I'm not interested?
Putting yourself out there and trying to date can make anyone feel nervous or scared. But the more you educate and understand yourself and your own value, the better you'll get at feeling confident in making healthy decisions.
There are certain issues that people with disabilities could be more likely to face. Sometimes it can feel like parents are overprotective when it comes to dating. Or friends might not think of us in a romantic way because they don't understand that we have the same kinds of feelings. And there are some specific challenges that a person with disabilities might have to deal with. For example, if you have trouble communicating verbally, you'd have to find ways other than speech to express yourself or give consent, like using body language, adaptive devices, or pictures.
Think of it this way. Everyone's body is different and needs help from time to time. And regardless of a person's physical ability, they can have the same feelings, hopes, and dreams as anyone.
Thanks, guys. I think I get it now. Sorry I didn't understand before, Alex.
It's okay.
And you know what? I've got something that's gonna make your date with Jabu even more awesome. One double nuts chocolate bar with mint chips and caramel, and a honey bar with icing.
Thanks, but were those in your pockets?
Just since this morning.
Ew.
Okay, so this is the part of our time together where we open up the floor to all of you listeners with a focus on young people with disabilities. What did you think of that video? What were the messages that you were taking away? Comments, reactions? Please, I'm looking in the chat box. People can unmute themselves and make comments. The floor is open. Okay, I am seeing, I'm gonna read some of the comments. We have Oleide saying that that was really informative. It addressed the myths about persons with disabilities being asexual, and that's absolutely true. We know that young people with disabilities, have a sexuality like anyone else, want to share and express their sexuality, that they have diverse sexual orientations, and that the layers of intersectionality can be much more, in fact. Okay, so I'm getting another comment here saying, great materials, Maria. How are they being received in the school sector? Okay, this video is a new one. We just launched it on the website a month or two ago. And so what we're hoping is through sharing it with partners like you, that you use it in your programs. And this is one of many videos. But this video in particular is very focused on disabilities, as you can see. Our other videos have other sexual and reproductive health topics where some of the videos also feature young people with disabilities, as part of the characters. But this one is 100% on the topic. You can access them on the Amaze website. You can also access them. We have some of the playlists on our UNFPA web pages. We are incorporating them into the scripted lesson plans. So you heard Jill's presentation around the breaking the silence approach to comprehensive sexuality education for young people with disabilities. That set of materials is to be used in and out of schools. And as we train teachers and as we produce these lesson plans, these videos will be embedded. So if, for example, if there's a topic on gender-based violence, if there's a video related to that, we'll embed these videos in. Okay, so that's how we hope, but we want all of you to help us share, and you can watch them on YouTube. So if you get onto the Amaze site, it links you to the YouTube channels where you see a number of different videos. On the website itself, there are also a bunch of resources for educators, teachers and learning. So I see my colleague Lindiwe shared one of the links, the main webs, yes. And then I see we need to be open and communicate, use different ways of communication would facilitate understanding persons with disabilities, different types of disabilities. Yes, Nadia, a colleague from UNFPA, is making a great point here. She's saying, first of all, we acknowledge that different types of disabilities requires different responses or approaches in sexuality education, as well as in service provision. So if it's like health services. So we know that, our ways of communicating with the hearing impaired is different than the visually impaired, is different than the physically challenged and severity. So we acknowledge that. I'm going down the line of the messages here. The video was great. Despite disabilities, people can still communicate using different means like body language. Yes. I actually want to share that video the video is there for anyone to use. You can go right on to the website right now and watch that and many other videos. The other comment I see is from Rebecca. Rebecca Johns is one of the co-authors of the Breaking the Silence materials. So that content that we use, I think it shows that others simply focus on the disability. But for the young person with the disability, their interests and questions. Boosie, can you mute, please? Thank you. So Rebecca's point is that, for the young person with the disability, they don't want all the focus and all their identity to be just about their disability. It's very much the focus of Paul Chappell's research on sexuality and disability, who was a co-author of the Breaking the Silence materials, okay? So it's getting to know the person holistically, not just the disability label per se. Josephine writes, young people with disabilities are people first and have the same needs as everyone out there. The video is quite interactive and really dispels the myths about sexuality of persons with disabilities. What we can say, Jill said it in her recording, if you caught it, is that there's so much misinformation or misconceptions. And they're usually like what Clobesile said, either the expectation is that they're asexual, or sometimes it goes to the other extreme, particularly around intellectual disabilities, where sometimes they seem oversexed or cannot control their sexuality. And we need to dispel that myth. And we know how critically important all of us as stakeholders are in advocating for this and having parents, teachers, health workers, religious leaders, all of our stakeholders, research coming together and understanding this, okay? It doesn't come easy to go into a classroom and talk about these issues. Our ministries of education also need training and understanding. Okay, people can also come in. I see the video was great. Reminds us that there are different ways of reaching youth with disabilities in terms of communication, language, disability friendliness. Yes. Again, we found that with lockdowns and school closures and all that, these videos were the go-to. We referred people to these videos. We also engaged radio. We know that radio is an old-fashioned form of communication in our region here, but it sure came in handy during the coronavirus, and we still have some radio programs that are important and can reach those left behind, like young people with disabilities out there. And then what else? That's from Melaku out in, shout out to Ethiopia in the house. And then we have, some people have raised their hands. Wait, I'm gonna just read the rest and then I'll go to the people who wanna speak. Great video from Lucetta from UNFPA. In addition to being informative, it's also interesting and easy to follow the issues faced by young people with disabilities. Rebecca also comes in and says, I think we also need to remember youth with intellectual disabilities who would struggle to access these materials themselves and need educators and families to advocate for them to access the information. Okay. Okay, we've got PPAZ from Zambia in the house. Okay, I think we had somebody who wanted to actually take the floor and speak. So let me cut myself off and put myself on mute, and please, will the person who wants to make comments go right ahead? Who's that now? That's Nolutando. Nolutando, the floor is yours. Over.
Hi everyone. My name is Nolutando Makalima. I am one of the people who is living with a disability. I'm not sure whether can you hear me.
Yes, we can hear you. Welcome, and please go ahead. Please go ahead.
I've got few questions, and I've got also I might say a things that I would love to talk about. Stigma. People outside there are people outside there. They are showing us different things since we are disabled. Number one, the employment. To us, it is so hard to get the employment, and then you'll find out that in most of the companies, there is no one who is living with a disability who is working there. So to me, it is also one of the discriminations that government has or have towards us. Ne? Number two, in the clinics, we go to the clinics as everyone else. Like we go to the clinic to prepare for the presentation for the presentations of pregnancy, and then the next day will be like, why are you here? I'm supposed to be at home. Mind you, we also have feelings like everyone else. Ne? So to me, disability, it is the most issue in the whole world. Even outside there, even in our government, we are facing a lot of issues, especially employment and in the clinics. Like we are really struggling, and also programs. Some of the programs are not meant for us because some of it because some they will say they want people who've got disability, but then you go there and then you find out that there is no accessibility for us to be working there, or for us to go there and do what we are supposed to do. Transportation, it is the worst thing that we face, because we can't go to we can't use public transport. You see, some of us got wheelchairs, and then we can't go to the taxi rank, and then we stand on a queue on a taxi rank, and then you see those. So I think people who are, and then I think us as a people who are disabled, we are so discriminated, I won't say so, and then we are also victim recognized by the government or also by our communities. I'm done.
Nolutando, we want to sincerely thank you for keeping it real, for keeping us on track and remembering that there's a lot of stigma and discrimination out there. And that, you know, some of us that are not disabled or have less visible disabilities, you know, we need to understand better. And that's why we're having this dialogue. We need to understand better. We need people like you and the other people on this call that are disabled to tell us how we can do better, how our governments can be accountable, how our health systems can be more disability responsive, as we've said. The simple thing of getting to a clinic, you've outlined very well, just the transportation, and then once you get in, then to hear a health provider tell you, you know, why do you need contraception? You shouldn't be having sex, you should be home anyway. We hear this story, these kinds of experiences all too often. I pray for the day that we don't hear these stories anymore and you can tell us different stories about the good services you provide, the helpful, comprehensive sexuality education you received from early ages through your schooling or through your young adulthood. How can we do better? The chat is open. I think there's someone else that wanted to speak. I'd like to open the floor to another speaker. Who would like to go next and put their voice into this discussion? Who's up?
Hi again. On that question of that, how can we do better? How about each and every company got maybe 3 or 4 people or person who got a disability? Maybe maybe that could also help. You see, because now you can, because now you will find out that we want jobs, but then you don't know where to go. Although we do have our own qualifications, but then the government will say no, we don't have a job for you, or else here is the leadership. Although the leadership, we can't move with the leadership. You see that?
Thank you, Nolontondo. I think you've raised that issue that, you know, economic empowerment, being able to have a job and support yourself is still at the top of the agenda. And we take note of that. And we've seen in the policies that a lot of the disability sector policies are more focused on that. And then somehow they leave the sexual and reproductive health stuff out of those policies. So we need both of them in, since today we're focusing also on sexual and reproductive health and rights. I see Bongani is ready to take the floor. Bongani, please introduce yourself, tell us where you're from, and share your thoughts with us. Over.
Okay, I wanted to put my video on, but apparently the host has stopped it.
Hi, you are now able to do it now. It should be open.
Okay, go ahead, Bongani. Let's see.
No, that is what my laptop is telling me, that it cannot do it.
Okay, while we sort that out. Oh, here you go.
Thank you. Okay, hi everybody. So my name is Bongani and I'm from Stellenbosch University. So I wanted to reflect just a little bit on the video that was flighted earlier. It appears as it is in an educational setting, almost like a secondary school of some sort. And for me, it sort of like raises the question of which educational settings are better, or which schooling settings match the needs of children with disabilities more than others. For instance, there is an ongoing contestation between are special schools better, or should kids with disabilities be in mainstream schools where they are with able-bodied kids, you know? Because as much as we would like to imagine that everyone is able to relate to everyone immediately, that is not always the case. For instance, the fact that they raise the question such as, you know, does the other kid's organs function? You know, as much as it's a good conversation starter, so to speak, but it is rather an intrusive thing to even, you know, raise and expect someone who is not in a setting where there are people like them around, you know. And I remember, perhaps if maybe I just say a little bit about myself. I went to a special school since 5 years old, basically. The first time I was in a different setting was when I, you know, came to university, meaning all of a sudden now you're amongst different and all kinds of people, really. And once that happens, I remember once we were, you know, back in school, we were always aware that, you know, we have girls around, and, you know, there are methods of attraction that pretty much any teenager goes through. You know, you'll see girls and you always want to chat them up and, you know, stuff like that, which is basically what everybody does. But the question was always about integration, you know, into mainstream society. I mean, do our so-called, you know, needs, are they respected? Are they recognized? How are we going to fit in, you know? And I think it's a journey that can take quite a bit of time. And it is also something that can require a lot of reflection and a lot of formation of identity from the person with the disability, in them being able to realize their own sexuality and what is their stance on it, and how are they able to relate to people of the opposite gender. So as much as I think it's a very, very educational video, I think it would probably educate mainstream society quite a bit, you know, a bit more, I think. But I think that journey of sexuality and being able to relate to other people sexually is a very, very personal one, and it can be very taxing. It can take someone at some point not being able to understand themselves first, but I think it's something worth going into so that they are able to relate to the world a bit better. Thank you.
Thank you, Bongani, so much for sharing your perspective. I think we won't get to the bottom of this inclusive school versus mainstream school thing. I think maybe it also depends on the type of disability or severity, of course. But what you've also shared is this assumption that people with disabilities want to talk about their sexuality. So you've already challenged us a bit there, and I appreciate that. What I will say about the video, to remind everyone, is it's they're directed to the 10 to 14-year-old audience. We use them in educational settings. We use them in teacher training. We're using them here today to show the type of resources that are possible. But yeah, we understand that it's just a couple of minutes and it's very contained in its content. I think that many of us that haven't grown up with disabilities or with people in our lives, you know, that have different disabilities, you know, it is natural to have some questions, and and want to seek answers on both sides of that equation. But thank you so much. Clobesile, I think you were up next. Go ahead, take the floor, dear.
I was up next, but then the gentleman before me said a lot and then I got lost. Could you please repeat your question for me? I had so much to say.
I know you have so much to say. No, so here we are, we have the opportunity to be together here and we want to do better. So how can we do better? How can governments be accountable to young people with disabilities on their sexual reproductive health and rights? How can our programs be better? How, from your perspective, from the perspective of all the young people you work with, Clobesile, tell us how we can do better for you and for the communities you serve. Thank you.
Okay. I think for me, the best thing is have like an intersectoral approach to everything. Because like for me, for instance, I'm a young Black woman who's also gay and who's also living with a disability. I don't just fit into just meetings where it's just for young women or it's just for people with disabilities, or I fit in so many boxes. And I think a lot of people with disabilities are robbed of that that social aspect of themselves, that personal aspect of just being more than just a person with a disability and having so many other social groups that you belong to. So what we do as the Pink Roses Foundation is we try to make everything, I know it's not really easy, but we try to make everything very inclusive. For instance, when we're doing a campaign on gay rights or the LGBT plus campaign, we always make sure that people with disabilities are always included and they never feel left out, whether it's in like making them aware of such campaigns, making them aware of everything that's going to be happening, and also making sure that the venues and the spaces that we are working at are going to be accessible for people with disabilities, and they're also going to be accommodative. Like if I am having an event, do I have my sign language interpreter? Do I have someone who's going to be helping the people who are visually impaired? Do we have ramps that are going to make it the venue accessible for people in wheelchairs and so on? So it's that, and to partner with other organizations that are outside of the disability space and say, hey, we know that you're doing this, but then we see that you are missing the disability inclusivity of your whole program. So can we help you out in making your program more disability inclusive or more disability friendly and stuff? So the biggest part of everything that we should all do in like making sure that sexual reproductive health rights and services meet everyone is to work together, be it within the disability space and even outside the disability space. And when we see that no one is actually making an effort in partnering with us or with us organizations that deal with disabilities, let's go out there and kind of like force people to say like, hey, I want to work with you in this and this and that. And I've received a lot of positive response from a lot of organizations who know the importance of sexual reproductive health rights services for young people with disabilities. So it's within us, within the disability space, to go out there and make sure that everything happens, and also with everybody, just partnering with everyone. Thank you.
Thank you so much, Clobesile, for many, many great points there on intersectionality, on inclusiveness. I mean, that makes me think about, you know, whether it's a webinar like this or whether it's a face-to-face meeting, you know, how if we're really going to be serious about inclusion, it does come at a financial cost, you know, to ensure that there's sign language interpretation, to ensure that the venues are accessible, to ensure that communication is available for low vision or, you know, whatever the disability is. So, I mean, it means that we need costed plans. I think we all think of activities and we try, but, you know, at a higher level of government planning, when you look at the policies, a lot of them are not costed. And so to say we must train health workers, for example, in sign language or in, how to serve disabled young people better, we need to do it. We need to cost it. So let's think about that as we get into next year and in the run up to 2030 for the SDGs and leaving no one behind, and this project that we're all a part of. Let us really think about doing things better in terms of really planning, costing it out, raising resources, et cetera, et cetera. Okay, I want to turn, now we've gone from South Africa, let's go up to Ethiopia. Meleku, do you want to take the floor, please? Thank you.
Thank you so much, Maria. I mean, this is a very wonderful session, really. I really enjoyed it. One thing, the video is, it talks to, our mind, talks to what we have experienced as a person with disability. I myself, a person with physical disability, during my early days at school, people used to have this polarized thinking toward this sexuality of youth with disabilities. Some see us as sexual, others consider us as a hypersexual. So I think this needs to change, and I'm very happy to see that UNFPA is already trying to do a lot in this area. I would like to remind colleagues here also working in this area. There is this excellent material which was published back in 2018 by UNFPA, the Women and Young Persons with Disabilities Guideline. It is related with how we can provide rights-based services, gender-responsive services to address GBV and SRHR. So this is something, we use it every day as a Bible. And I really would like to also recommend UNFPA to consider, publishing such kind of documents related with adolescent and youth with disabilities, because this one is already tested. It has been really helpful. But you already touched it, Maria, what we need to improve for the future. I think it is important to really have this framework, when we consider ourselves to be inclusive of adolescent and youth with disabilities. We have to see it in a framework of this awareness, what we are trying to do. So we need to keep pushing, keep educating people, of course, as it was indicated, considering and taking account of the intersectionality of people with disabilities themselves and also the challenges they experience. So that is the most important thing. The second thing is our communications, the way we communicate, with our audience, our stakeholders, government, development actors, key players, including those who are in the grassroots, because even people with disabilities themselves, considering their disability type, their issues. So our communication needs to be tailored toward that one. And the challenges that we face, here, and as a physically impaired person myself, and my friend who is deaf, or my sister who is blind, it could be different. So it also needs to consider those difference, and also within the sexuality, all the intersectionalities as well. The other is accessibility. I know, accessibility means a number of things. It could include the physical accessibility, but not only that one. Even these days, the web accessibility and all the others needs to be really, considered. Even those who live in rural areas, those who are out of school, do they really get our message, being received? Or those who are disadvantaged in poor and under disadvantaged communities. So that is on the participation. Maria, you touched it very well. On the participation, not only saying consulting adolescent and youth with disabilities and their associations. Of course, that is very important. No, but it should go beyond consulting them. They need to be involved also. They need to be truly engaged in what we do. To do that, one of the one of the way we show our commitment is budgeting. Because if there is no budgeting, it means that we are not prepared to deliver on our promises. So this is some of the things I would like to share. And thank you so much for everything what you have been doing, the partners in Sexuality and all the other colleagues who are here today. Thank you.
Thank you, Melaku, for sharing. First of all, you've got the nice screen background from the Ethiopian Center for Disability and Development. Great. We know that you're such an important partner, being a professional in this space, and you've really touched upon a number of things. What I'd like to say to everyone on the call is that, creating the sexuality education materials that have all that adaptability depending on the type of disability has been a labor of love of Dr. Jill, Rebecca, and the late Paul Chappell, and more recently myself and PSH. I mean, it takes years to get it right. And so hopefully you all can benefit from those years of planning and testing and piloting and tweaking very soon, so that we get it right and we get the feedback and you all implement and let us know how it's going. Okay, so I think we have another speaker. Was it Rhoda? Rhoda, over to you.
Thank you so much, Maria. Maria, I wanted to just say thank you very much to you and all the organizers for a very informative session. I want to particularly thank my colleague, Mr. Weideman, and then also Tandeka, who invited me to the session quite last minute, but I'm so thrilled to be here. I have found it to be very informative. And what I want to say at this stage is that I work at the head office of the Western Cape Education Department, and I work at the Directorate of Inclusive Education, where I work as the provincial manager for schools of skills in the Western Cape. And I'm responsible for about 25 schools of skills. And within the school of skills sector, we target youth between the ages of 14 and 18 years old. And what this session has done for me is it has really cast a spotlight for me on all the issues that you are talking about. Because I feel that with the youth that we work with, not enough focus within my sector is given to this particular aspect. Especially, I've spent my entire career in special needs schools, and the issues of the teachers and their preparedness to actually go there and have the discussions around sexuality and reproductive health. You often find that there are so many taboos where people are just not comfortable in going there. And I also find, with the parents as well, for various reasons, that often the learners who do have these various challenges, they face a stumbling block where they don't have that go-to person or people to be comfortable enough to speak to. And I think with us being in the Inclusive Education Directorate, we've been so focused on barriers to learning and all the barriers that make, the curriculum inaccessible and other things, that I feel maybe for me personally, I could focus more on issues of sexuality, gender, issues like this, and hone in a bit more with my group. So I'm definitely going to prioritize this for closer focus next year. And here I don't want to take anything away from anyone, because I know our HIV group, our social workers, they're doing a remarkable job. But I do feel that within the group that I work with, I do find that, there are young learners who are already mothers, learners who, because of the intellectual disabilities, they have mild intellectual disabilities, they are often vulnerable and taken advantage of. So I feel like this has been so useful for me, and you shared a lot that is making me enthusiastic to want to do more for the learners that I work with. We are very focused on boosting their self-esteem, providing them with a sense of belonging, a sense of self-worth within the school of skills, so that they can feel comfortable enough to reach out. But I think we can do more in taking that next step to make more of this accessible to them and just to support them even better. So thank you very much from my side to all of you for a wonderful program. I appreciate it.
Oh, Rhoda, music to our ears. We need more people like you to get on to network with and we be in this together. We really appreciate all your supportive words, and we'll be working with you very much because the DBE is supportive of this program. The DBE is also needing support because aside from all the training and the capacity building that has to take place, we are in an environment where sexuality education for mainstream learners, if you will, is under threat and faces opposition. In fact, some of us on this call, Dr. Finn and I, are participating in another meeting tomorrow where, we're trying to strategize. How do we advocate better? Don't get distracted, because really we know young people need this information. It's their right. It's their right to we need to see young people with disabilities as whole people. Okay, I see that we've got Bongani and Nolutando want to make additional remarks. Is there anybody else that would like to speak before we go back to speakers that have already spoken? If not, we're gonna go over to Bongani. Bongani, go right ahead. Thank you.
All right. Thank you, Maria. So there was a comment that was made earlier in the chat box here about one size does not fit all, and I couldn't agree more. Disabilities vary, needs are different, and even from a solutions point of view, we'd like to, for instance, talk about universal design access and solution-driven interventions of that nature. They all would fall short somewhere, and disability is a very much under-resourced sector, and I think it's going to be under-resourced for a long time to come, simply because you are dealing with the minority community with very complex needs. But with that said, I just wanted to speak to the point of departments, departments that come up with programs, those programs are informed by policies, and policies are informed by research, and research is informed by experiences, experiences that researchers have to rely on, and participants actually contribute, and we work some of them here, in universities with academics, and it's very key that research-based information is encouraged to keep flowing, because I think if we are able to shift narratives from where we don't have reliable information to a point whereby we have information that is reliable, that can be used to inform policy, it's something that has to start from somewhere. So I think what I would really like to encourage with everyone that is here is when they do get an opportunity or a chance to participate in any form of research and be able to voice their concerns and most importantly, vocalize their narratives. It's very key, because that information filters through into avenues whereby policies are made, and this is basically the tools that can make a difference in a grander scheme of things or the bigger picture. Thank you.
Thank you, Bongani. In fact, you have several researchers on the call, Dr. Finn, Dr. Jill. We're trying to do implementation research attached to the sexuality education, breaking the silence approach that we're doing, so that we can see, is it feasible in schools? Is it feasible out of schools? Is the content, the information being well transmitted from the teacher or the facilitator to the learner? Is the learner absorbing that information, and is it impacting their sexuality, their self-esteem, their life skills, their ability to access services? So thank you for bringing that aspect up. There's a lot of research questions for sure. The other piece of information I can share about UNFPA is that we're influencing the national census of our various countries to ensure that disability questions are included. The Washington set of questions where we just need basic information. How many of the population of a particular country are disabled and what type of disability do they have? And how many are male, how many are female? Because all of that is important information to bring resources to our cause. So thanks for bringing that up. And we will continue working with you because I see you have a lot to share. And we have Noluntando that's gonna make a remark. I'm noting the time. So if there's no other speaker, she will be the last speaker. But if you have something burning you'd like to put in the chat or would like to be the last speaker before I close this part, please let us know. Over to you, dear Noluntando.
Hi again. I have a challenging question to Patsy or to the organization or to PSH. In your organization, do you have maybe one or two person who is living with a disability? If not, how do you compile those programs or those videos without a person who is living with a disability in your organization? Those are that is my question.
Thank you. Thank you, Noluntando. In fact, when I turn over, it is to Patsy, who will be able to speak to that. But I want to thank all of you for watching the video, for listening to all of us prior, and sharing your thoughts, feelings, reactions, comments, okay? I think we're just, gaining momentum in this space, and we hope that we have all of your contact details so that we can continue to convene and continue to learn and share from one another. It's been my pleasure to facilitate this dialogue. Again, I'm Maria Bacarudas from UNFPA East and Southern Africa Regional Office, one of the partners of the project with PSH and South Africa Medical Research Council. And it's an exciting space. Let's see what we can do together next to really improve things. Over to you, Madam Chair. Bye from me.
Yes, thank you very much, Maria. My role now is basically to close down the meeting, but before I do so and do my thank yous to everybody, I just want to quickly reply on the question that was posted to PSH. Currently within PSH, we only have one person that is disabled within our organization. However, we have a youth network that is called the Sexuality Youth Network. And one of our approaches that we've been doing is to ensure that our Sexuality Youth Network in South Africa is an inclusive youth network for every single young person. So what we've been trying to do over the years within the Sexuality Youth Network is to make sure that we actually approach young people that is blind. We're entering now with the deaf community. We are opening up the space where we actually want to sign MOUs with these sectors so that we can make sure that our young people with disabilities are inclusive within our activities. The reason for doing this is because, as I've noted and I've seen in all the chats, is that yes, before you are a person is disabled, you are a person and a young person first and foremost. And that is how PSH approach our young people. Yes, there is key populations. Yes, there's young people with disabilities. Yes, there is. But ultimately, it is a young person first and foremost. So we are not perfect, I have to say, in terms of addressing all our young people's needs, but at least we are trying. So in that sense, what we then try to do is to at least bring our young people with disabilities within our sector, within the Siakwazi Youth Network, so that they have an ability to raise their voice within a bigger scope of young people and actually address the rights of young people with disabilities. I'm hoping I'm answering your question. I mean, we can always chat afterwards. If you have any ideas how we can improve, by all means, I'm open for any conversation, discussions, how we can move forward. I think the platform that we've actually created here today is for people to understand that we are serious in terms of young people with disabilities, in terms of sexual reproductive health and rights. Reason why we've started the Leaving No One Behind project. So on that note, I want to say thank you very much for Maria from UNFPA. Thank you very much, Professor Finn from the UN Science Risk Council. Thank you very much for Jill in her absence, but I think she said the video with us, which is very informative. So from our side as partners in sexual health, and all our partners within the Leaving No One Behind project, I want to say thank you to each and everyone that took the time to listen to our speakers, engaging with us, sharing your ideas, sharing the challenges. I do take note of it. I think UNFPA is taking note of it. Even all the partners as part and puzzle of this meeting is taking part, is listen to all the challenges. And I think the most important thing for me as I was sitting and writing down some of these notes is to understand that today we've actually gained new partners to move forward in the space of disability. And that for me is critical. So you will not be the last hearing from us. We will contact each and every one of you. You are welcome to contact any one of us, so that whatever we do, please give information, share information you've had, help us to do things better. As Maria so profoundly earlier said, on help us to do things better, so that it doesn't just come from us, but it comes from everybody that have an impact, influence, interest within the disability sector, and specifically when it comes to sexual reproductive health and rights, because that is the key for us. I want to say also thank you to all of my word. I am so embarrassed now. Now I cannot pronounce the name. Solo Bisile, one of our speakers. Sorry, my angel, that I cannot pronounce your name correctly, but thank you very, very, very much.
You can call me Ina Mandla if you want.
Oh, thank you, my angel. I also want to thank our sign language interpreters. Thank you very much. Thank you. Thank you for your support. Thank you for providing us and being part and parcel of this, so that we can actually ensure that people understand that we are serious when we talk about young people with disabilities, that we make sure that everybody understands our interpreters. So thank you. Thank you. Thank you. Thank you for everybody. You must have a great day, and God bless. Thank you very much. Au revoir. Bye-bye.
Thank you everybody for joining us today, including the Western Cape Education Department. We had a great time with you all. Happy International Day of Persons with Disabilities. As we continue to move forward, may we always remember to always leave no one behind. Thank you, everyone.
Bye-bye, bye-bye. I don't know what's happening with my screen, but yes. Thank you, bye-bye.
Bye.
Thank you, thank you. We'll put all the resources together on the page.
Yes, yes, yes.
Great stuff.